Well, for more on China's efforts to control the spread of the virus, our Beijing correspondent Olivia Xiong joins us once again in the studio on this Thursday morning. And Olivia, as we're looking at these latest numbers, a spike in terms of the deaths and also the new cases, although the WHO is saying that, we need to, it's positive, but we need to sort of take extreme caution with this. President Xi Jinping, just last week, criticizing governments over the overreaction here, to the outbreak.
I think it's notable with these numbers just coming out from Hubei. This is really a massive jump in the number of new confirmed cases. And here we are talking about over 14,000 new cases. Just by comparison, yesterday out of Hubei, the number of new cases reported was 1,638.
So it is a really big jump.
It is a really big jump. And that's one reason for this huge jump in the number of new cases is because of a new testing method. As we had heard from reports, many patients who had shown signs of pneumonia or the flu symptoms were not able to be tested because of the medical facilities in Hubei and especially in Wuhan have been extremely stretched. So authorities have started to use CT scans to be able to start some testing of patients who are starting to show signs of this pneumonia so as to speed up, perhaps their isolation and treatment as well. But this is certainly going to be a lot of concern because this is a massive jump in the number of new cases that we are seeing. And it's coming just after President Xi was said to have presided, over that meeting with China's top Politburo Standing Committee. The last meeting prior to that had been more about containing the virus, but this time we saw President Xi stressing a need to coordinate control of the epidemic, but also balancing that rather with socio-economic development. As we know, this week, many Chinese provinces are getting back into operations, but it's not been business as usual. So a lot of disruptions in the economy as well. And that's really the dilemma because with the resumption of operations, we're talking about possibly about 160 million people trying to return from their hometowns during this Chinese New Year break. And that definitely increases the risk of the transmission of the virus.
In a way, there's a possibility that we could actually see an increase in the numbers as they return to what you just don't know with these new testing capabilities.
But at the same time, the concern is really the economy as well. We know that China's economy, even prior to the outbreak, has been of concern with its GDP growth showing its slowest in 3 decades. So that's already a concern. And then with disruptions to business operations, then we're talking about disruptions to international supply chains. And so what does that mean for the whole of China?
Yeah, Olivia, so going back to in terms of how China is tackling the health crisis, I mean, the WHO and also Mr. Trump seems to think China is doing a good job. They're praising China's extraordinary efforts, so to speak. But within China itself, and there seems to be growing sort of anger and frustration over how the authorities are dealing with the situation, especially after it came to light the death of the whistleblowing doctor Li Wenliang. So why so much public anger?
Well, with the case of Dr. Li, he was one of the first to sound the alarm of a SARS-like virus. But if you recall, 8 people in Wuhan were reprimanded for so-called spreading rumors and false information. And so many people feel that, if they had been taken seriously, then the situation may not have gotten to the stage that we are seeing today. And so that's one part of the anger. But now as the outbreak has continued, there are also many reports of other blunders, potentially from local authorities, and people are angry. Most recently, there are reports of an incident where some severely ill patients in Wuchang district were scheduled to be transferred to a hospital on Sunday, but then authorities were said to not have prepared enough transport, and these patients were left waiting for a very long time. And then that caused a lot of anger. And then when the district official went in person to apologize. He was accused of taking up protective suits and gear, which is in short supply for medical staff. And so people are angry with the way that this is being managed. And we've already seen top officials in Hubei being removed from their posts, others from Wuhan being summoned to explain. And central government authorities have said that if there have been any faults with the local authorities, that there will be consequences for that. And so that's that's part of the reason why people are so outraged. But also we have seen in recent times a tightening of the media control and censorship in China, as well as there's been concern about this public outrage. And, the media reports have said that Chinese media outlets have been told to tone down their coverage as well.
All right. In the meantime, of course, the World Health Organization has been everything but praise for China in terms of containing the spread of this virus is getting, as of today, a little bit worse. And yet at the same time sort of advising countries not to restrict travel and trade. Why are countries not heeding that advice? And what's China's response been to that? Because it must be tough for them, and of course the knock-on effect on its economy as well.
Exactly. I would say that many experts do think that the World Health Organization is being caught somewhat in the middle with a big, powerful country like China. They are saying that perhaps they have come under some sort of pressure, even though the WHO chief has denied this. China has said that, it has maintained its transparency and has been working with the World Health Organization from the start. I think part of the concern has been that some people do feel that the WHO took some time, for one, to declare a global public health emergency at the end of last month. And even when it had declared it an emergency, the WHO chief said that this was not because of what was happening within China, but because of concern of what might happen in other countries as well.